Hi, welcome everyone. Thank you so much for being here today. My name is Veronica Butcher. I am the Executive Director of Mothers and Others for Clean Air. Welcome to our brand new speaker series, Clean Air Conversations. We had planned to do a big conference later this year with lots of speakers and listening sessions, and of course, the new normal, we can't do that. So we decided, you know what, we're gonna do it online. So thank you all for being here. This is different. You're not gonna see slides. This is a conversation, so we want you to ask questions and engage with us as we go along. Also be sure to save the date. Our next Clean Air conversation will be June 9th with our co-founders Stephanie Blank and Laura Turner Seidel. And they will be talking about the rollbacks from the Trump administration and are our children really breathing easier. So today, here at Mothers and Others for Clean Air, we are working with caretakers, health professionals, scientists, teachers, and youth all across the Southeast in order to create ripples of individual and communities change. We do that through working in partnership with our Healthy Air Alliance of the Southeast, building the capacity and uniting organizations across the South at the intersection of children's health, air pollution, and climate change. And our goal is that no more children in the South die from air pollution. And it's my great honor now to introduce to my friend, Reverend Dr. Gerald Durley, a staunch advocate for civil rights and climate justice. Reverend Dr. Durley has served for over 25 years as a pastor of Providence Missionary Baptist Church, where he serves now as emeritus pastor. I believe I got that correct, Dr. Durley. He became intensely involved during his tenure in climate change, global warming, and the environmental justice movement. The first time I ever heard him speak, he spoke very passionately and totally shifted my mindset on that climate change is the civil rights issue of this time. Dr. Durley now combines the disciplines of faith and science with lessons learned as a civil and human rights advocate, marching with Dr. Martin Luther King during the 60s. And we are so grateful for his support of our organization and for being here today. Dr. Durley, I turn it over to you and your esteemed panelists for this conversation.
Thank you so much, Veronica. This is a very special time in the history of our country. And I'm so excited along with these expert panelists to be here to discuss something that means so much to all of us. We're in the middle of a pandemic that has stopped the world, shut down the world literally, economically, politically, scientifically. It has shut the world down. But it is so important what mothers and others are doing to discuss clean air around the world. Just think right now, one virus has shut the world down, but yet all throughout the week and all throughout the year, there is a pandemic in the air, the polluted air, the toxic waste dumps. These are all around our children all year long. So today, we'd like to ask some of the questions that possibly you have, or that I certainly have, around how do we begin to look at and make a difference legislatively and in our homes and in our culture, in our places of worship, to have a clean air for our children. Our children now are being totally decimated by what we're doing because we're putting profits over people. So today we have a sterling panel, those who have been involved in this for some time. The Reverend Michael Malcolm, who is with Alabama Interfaith Power and Light, who's done so many things with Interfaith Power and Light for so many years. And then Dr. Adrienne Hollis, who's with the Union of Concerned Scientists, who not only understands the scientific side of it, but also understands the pragmatic and the social side of what it is that we're doing. And Dr. Kim Cobb from Georgia Tech, a great institution that's done so much in this area. So I want to welcome all of you to this panel, this conversation around clean air conversation. Welcome all of you. And many of us are asking the question, we've heard all of the breaking news and all of the discussions on all of the news outlets. And the question I'd like to ask you is air pollution and climate change impacting some communities more than others? Any one of you can just step in. We want to have a free-flowing conversation, and I'll be asking you questions, and people will be chatting from the chat room, and we'll just ask the questions. But are there some communities that are disproportionately negatively impacted by this, by air pollution?
Yeah, I'll jump in. The answer to your question from my perspective is absolutely. And those are the communities that are our environmental justice communities, our frontline communities. The main reason that they're more impacted is structural racism, where they're situated, what they're exposed to, what they breathe regularly from polluting facilities, as well as being placed in areas where there is no surcease from the effects of climate change. There's no green space, their buildings are close together, so they have the urban heat island effect and things of that nature. So my answer would be yes.
And I'll go behind Dr. Hollis, if that's okay. And I would say absolutely, emphatically, yes, as well. And in particular, looking at communities of faith, because the same thing that happens in regular community also happens in our congregations as well, because they are the ones that make up our congregation. So when you look at the suffering of congregations throughout our society right now, you look at who's disproportionately suffering behind the closing of churches or houses of worship. You look at not just the ill effects from a mental standpoint, but also an economical standpoint as well, because a lot of our churches are hubs for our communities' economic empowerment also. And so we are, and not just our economic and not just environmental, but socially as well, we draw our strength from these places as well. So we are also feeling the effects in communities of faith as well.
Thank you so much. Yeah. Dr. Cobb, do you want to add anything to that?
I don't know that I could. I mean, that's
Okay.
all well said.
They've been pretty clear. And that brings the question, do you think that it's being in the Southeast area more vulnerable than other areas of the country?
Well, I'll take a stab there. Absolutely, yes. I mean, the models are very clear about the coming impacts of climate change, raining disproportionately down on southeastern United States communities. And this is not just here, of course, it's also around the whole globe that the most vulnerable populations are going to be those that bear the brunt of the damages that are coming down. We've already seen this. We've seen this through events like Katrina. We've seen this through any number of different hurricane events. We see this in heat wave statistics every summer. These are some really crushing realities coming down to these communities, and these are often low-income communities of color that are going to bear this deepest price. And this is, again, something that we've seen and we will continue to see going forward.
Yeah, and if I can add to that,
sure.
I want to say that historically, these communities have been victimized by facilities that moved to the South because the laws are more lax, or they pay a small fine and they continue to pollute. And there's an issue, there's a question between, do I work to feed my family, or do I take a chance on becoming ill from exposure to pollutants? And then on top of that, now you have the effects of climate change on people who may already be in homes where the infrastructure is in question, right? Or people who live in homes now that may have mold because of some previous climate challenge. And now, because we're isolating at home, they're exposed, which makes them more at risk. So, it was a no-win situation. I don't know whether it was planned that way, but structurally it was no-win, a no-win situation.
Yeah. And in addition to the impacts that they feel from the pollution, now, because of COVID and them having to be isolated at home, they're trapped in those situations. It's for them, to leave the house is a reprieve from the disease that they feel when they're there. And because of COVID and not being able to go outside, it's now impacted because they're now having to sit under that 24/7. But Reb, I want to go a little bit further with that, because in the Southeast, none of our utilities or none of our policymakers have declared or regulated that there be moratoriums or that there be debt forgiveness for those who have had to stay at home because of unsafe conditions. And as a result, I really believe in my heart of hearts, and maybe this is a prophetic warning even, to say that don't be surprised when they start weaponizing utilities to force people to go back to work to restart the economy. And we as communities of faith, now that we are shut down and we can't necessarily go to our houses of worship, perhaps it's time for us to start rethinking the way that we serve our communities. And maybe, just maybe, we can weaponize ourselves to get in front of that so that we can head that off and not allow that to be a path to put people in harm's way.
So you're saying that there is possibly a direct correlation with climate change, equal justice, and this whole coronavirus. It's all working together. I noticed today the statistics said that one of the most devastated communities, which we don't even think about, the Navajo community, they are suffering at an alarming rate because they live in confined areas. They cannot leave the reservation, but on the reservation, they live closer together. So what would we need to do? I noticed under the climate change, and all of you have been working in this whole area, you've been talking about what the IPCC report and all of the others have done, and nobody is really listening from a larger standpoint of view. We've known about this virus coming on, and we didn't do anything. Now, from the climate change perspective, and how we're polluting the air and how we're destroying the children, what do we need to do? What can be said? How did your experiences come together to awaken a sleeping nation to the devastation that it's doing to our children, the air pollution?
I'd say, Reb, that I reject part of what you said, and part of what you said was we've known about, and the reality is we have not known about. They've known about, and they hadn't shared the information with we. And that's a huge part of the problem. Unfortunately, because of the way that society is set up now, we have a huge problem with distrust. So even when we get clear information, we don't even trust the source that it comes from. And so it's hard for us to hear the science because of the distrust that has come out for so long. And that only impacts the situation that we're in right now. So I don't necessarily say that we've known. I say they've known. And what can we do about it?
Now, help me with the we and the they. You're being somewhat nebulous to me.
Yeah, I appreciate that. And so the we would be the public, all of us. The they would be the systems that are giving us information, whether it be through the media, whether it be through our supposed leaders. You know, whatever the source is that gives the information has not always historically given us accurate information, which has caused distrust in the public. And so we don't get the proper information. We didn't know about COVID, but they did.
Well, those at the academic level, Dr. Cobb, I was gonna say, Dr. Cobb, you're in the educating, informing people, enlightening people. You all have known about this and your role as an educator.
Yeah, so I'm going to eat some humble pie on behalf of most scientists there and say that that the Reverend's absolutely right. It's not enough to put together these reports and throw them over the transom and assume that our job is done. You know, science is not enough right now. Science is a start. It's a part of a foundation. But if that foundation doesn't include justice and equity, then it's not going to work. And it's not going to work at any scale, whether that's a local community scale or electing the right kind of leadership to enact the right kind of policies to keep people safe. And I speak about that with respect to the spectrum of issues that we've touched on today. You know, these are intersecting issues, but they're all have the root cause is the same, which is the COVID pandemic, climate change, and air pollution. And this is a trifecta, should be a wake-up call for the kinds of compound threats that these communities are facing and how we have not done our jobs as scientists to center justice and equity in our work. We have not worked with the right kind of partners to enact change at the scales that we could, and we have not worked to get the leadership that we need at the highest levels either. So I would say, to your question directly, what can we do? I would say that we have to elect leaders who will not only enact data-driven, evidence-based policymaking, which would point to the impacts of air pollution on long-term health disparities across America, but also address the climate challenge and also get in front of whatever environmental and public health and safety crisis is going to come. So that is kind of eating some humble pie there and trying to see a way forward for my work as well as my colleagues.
How do you feel when they're not listening to the scientists? Dr. Fauci and others are saying certain things. Certainly you in the scientific area, you all have said, this is what is going on. This is what's happening. And no one pays you any attention. What do you do?
And I'm going to jump in and add a question from the audience that dovetail with this. We've got a question that says, so who are the trusted sources then?
Okay, first I have to say, this is something one of my colleagues, Dr. Jacoby Wilson said, the invisible has now become visible. We as the environmental justice community, we've been talking about these issues forever, right? And it has not gotten any traction. And one of the things that we need to be doing is addressing this from a public policy perspective. I wrote in one of my blogs that until the issue is recognized as a major issue, particularly the fact that African Americans are affected first and worst by this COVID-19, and in that I suggested that the Centers for Disease Control needs to raise it up as one of the high-risk populations, at-risk populations, at-risk populations, so that then we can impact public policy. To get to the question of who the trusted sources are, that's going to be, for me, somebody told me the other day, I'm not going anywhere until Dr. Fauci tells us to, or until we hear it from scientists, or in some cases, the church. And with no disrespect to our ministers here, I have to say that there is some distrust in churches that have continued to meet in spite of this pandemic. And now I know we have a church in Georgia that has closed down again because the congregations have become ill from COVID-19. For me, the church is a cornerstone, and people I know. So that is a trusted source for me.
Yeah, and even with that, Doc, bringing in the church, even with that, we have to have trusted sources. Even our leaders need to be trusted. I mean, it's sad that in some churches there is this whole war against intellect and education. And to be honest with you, right now, it's absolutely needed that I had this conversation with a group of pastors the other day, and I made the statement, and it went over their heads because of the sensitivity of where we are right now. But I said, COVID has taught us that we have to learn how to live outside of our offering plates, and what I was inviting them to was to stretch the conversation or stretch the thought of how we do ministry. But in all actuality, what would it look like for us to really join hands with some of the scientists and start developing resources for our congregations that can still have the science emphasis, but speak the language of faith?
Science and faith has never really been incongruent from the very beginning. And I think we have to put that in there when we're working together. There's been a lot of skepticism on some parts until we have more educated people. I spoke with a large group of ministers at one time here in Atlanta. They said that they wanted to prove that God would protect them from the virus but there are certain immutable laws that are in place. If you jump off of a building, there's the law of gravity that you can pray all day long, you're going to hit the ground. So you can pray all of this, you can believe all you want about this, but until you get the scientific data to combine with it, then we can have something to work together. I've often said that science, they want to put the information out there. Business, they want to make a profit. And politicians want power. All three of those can win, but they must be placed upon an ethical, moral foundation. We're in a moral, ethical war now, and until we infuse that along with the scientists, with the politicians and the business people, then we can have a win-win situation. Then we can be assured of cleaner air and whatever we have to do. But we've got to get away from that science and faith. Because I've seen a lot of scientists say, please pray for me when I go into the laboratory today, and vice versa. So we've got to get away from the ignorance, because ignorance breeds fear, and fear is deadly. It breeds hopelessness. So those of on the panel, so thank you so much for what you're doing. Are there any specific kind of policy changes or that we should be thinking about right now, where those on this conversation that you work with? I know you've written blogs, you've written papers, you teach. Pastor, you're still out there on the field. What kind of things would you see that we need to do now? We see where we see where the political situation is at the highest level. There's some things that we got to do. And what are those things that the everyday person who's trying to feed the family, trying to wear the mask, trying to wash their hands, what is it something that we can do, everyday people can do to mitigate this situation that we find ourselves today?
I'm going to say the first thing we need to do, and I'm thinking in terms of, I'm going to preface this one in terms of COVID and putting our people on the front, is that we need to set up a situation so that people don't have to return to an unsafe workplace. You know, for example, a state doesn't need to open for economic reasons. People don't need to go to work just because but they shouldn't have to go to work just because they need money. We need to have a system in place where, just like other countries, where we can financially support people who need it. We can provide food to people who need it. We should be working together. We're all in this together, right? And we need to, as I think was already said, look at who we're electing. If they're not for you, they're against you. And we need to hear what they have to say and ask the right questions. But what we really need to do is keep our eyes and ears open, because while we're in the middle of this pandemic, you guys, a number of environmental regulations have been rolled back, removed. We already know about one that's been weakened, right? Where EPA has pretty much given facilities the license to pollute.
Do whatever they want.
So we need to be aware, and we need to be active, and we need to make sure that our voices are heard. You see, I get pretty passionate about the need for community voices in this space.
I want to chime in there with an equal set of passion and a big pile on to what Dr. Hollis just said. First of all, amen to that. And I will add one thing that's so supremely important that has emerged from the literature lately is the importance of people talking about these issues to each other. And, we reverends, we hear from you sometimes from the pulpit there, but we don't bring those conversations home enough. We don't talk amongst our community. We sometimes want to protect even our children. We're not doing anybody any favors from not bringing these conversations to our lives and to sharing them across all the corners of our lives. So some people we want to have a certain conversation with. No, we need to talk about these issues, the structural racism, how it compounds the pandemic, how we have economic injustice at the core of this problem, what we care about, what our values are, what we want for our future as a country, and how we can play a role in electing officials and coming together to make some of that happen. So on the one hand, it's about transparency and accountability and access to information, which is severely lacking across most sectors of our information flow up to the highest levels right now. And on the other hand, it's about making sure that we are combating misinformation as it is rampantly being spread by parties that have vested interests in a fossil future that will undermine the health of our communities and forestall our low carbon future and frankly, our public health and safety. So those are some of the things that keep me up at night. But remember, folks, the importance of talking about this. And I love this conversation today and love what this organization is doing to hold these conversations.
And I'm going to jump in again, Reverend Durley. There's a lot of praise for talking about the elections. praise for Reverend Durley for a lot of what you're saying here, and the panelists. And I want to let everyone know that we have launched a Healthy Alliance of the Southeast. We've put in the chat box a link, and the goal of that is to connect doctors with scientists, with caretakers and teachers and youth, to bring people out of the silos across the Southeast. Go to the link, sign up, and join us. We have toolkits that we've created so that our partners can use them. We have a video series so that our partners can use them, and we'll have a film coming out later this year called Planet Prescription that's highlighting doctors in the Southeast working at the intersection of children's health, air pollution, and climate change. We're going to white label a screening toolkit so that congregations can screen it. It's not going to be branded mothers and others. So that we can work together in partnership truly. We have had a couple questions come in, so I'm going to insert this one here. Queen Shabazz asks, when are we going to stop the years of unnecessary studying and start doing something to prevent environmental harm that we are aware of? We also have a question here. Oh, no, that's a comment about checking out a recent Yale Connections study interview. So I'll leave that there. So when are we going to start doing something now that we're aware of it? I think there's a lot that we are doing. So let's talk a little bit about the solutions, individual and whatnot.
Yeah, so go ahead, Doc.
Go ahead, sir.
Okay, so I'll jump in with that question. When will we stop talking and start doing? I'll be honest with you, Queen. I'm asking the same thing myself. When will we stop talking and start doing? And I can only say for my own self and those who I have influence over that we are doing. It is a slow process. It does take a while because the Southeast has been so divided and has had to deal with so much disinformation that, in all honesty, we as a society in the South are ignorant to a whole lot of this. So I've been trying my best to raise the awareness and highlight the voices in community as best as I can. And I would say that that's something that we as communities of faith have the perfect opportunity and the perfect platform to do. Another thing that we talked about, or that has been talked about, or a constant theme that I'm hearing is elections. What would it look like for us as congregations in the time of COVID to use one of our Sundays to actually have somebody come in and talk about the voting process versus having a regular sermon? I can remember when COVID first happened and I had to declare that we weren't going to be in service before I took my sabbatical. I had somebody to come in and actually speak to the congregation about COVID and what it was and the whole thing, because I wanted to make sure that they were aware of what was actually taking place. If we can, as faith leaders, involve other disciplines and experts in our everyday, it would be so much better.
Dr. Cobb.
Yeah, I wanted to echo the point about partnerships that I think the Reverend was just referencing, and really highlight the need for sustained and long-term partnerships where there's the capability and the longevity to grow and learn together. Because I am learning about environmental justice after 15 years in climate science, and I'm an eager student, but I need time and I need some purchase there. And likewise, the partners that I work with down in Savannah, Dr. Mildred McLean of the Harambe House and EJ Icon, that I'm proud to call a partner on a project that I'm working with. She is a patient teacher, and we are trying to work together. How can we bring technology and science and the power that brings into a framework that is focused on equity and justice and impact? She keeps asking me the same thing. I'm sick of talking. I'm sick of studies. I want to see it on the ground. And so I want to give a shout out to her for that partnership. And we are in it for the long haul. And these are the kinds of partnerships that I think we should be seeking out wherever possible. And they should be fostered and encouraged by institutions like Georgia Tech.
Yeah.
That is so. Oh, no, go ahead, Doug.
I was going to say that one of the Hilton Kelly, and by the way, Dr. McLean is my idol. I love her. I've been working with her for years and years and years. Hilton Kelly from Port Arthur, Texas, is one of our partners in a program that we have at the Union of Concerned Scientists. And he reached out after once COVID-19 became this big issue. And he said, if there is no more important time for us to partner than now. You know, he was reaching out to the Union of Concerned Scientists, and we're working with he and Reverend Woodbury, Reverend Leo Woodbury in in
South Carolina, yeah.
Florence, South Carolina. He's gonna kill me. Florence, South Carolina, and Tejas and others, because this is the time, you know, as a scientist, under the precautionary principle, the rule is don't wait for hardline science before you make a move. If you have something that hits at an issue, act on it, right? We can't wait until, I mean, my God, how many people have to die before we realize that there's a problem? So my frustration is that we are getting the information out, but those who right now are in positions to enact change are not acting on it, right? And so, Queen Shabazz, I heard your question, and so my answer is not directed towards you, but it's people who express their frustration, and those of us who just express their frustration and we don't know who to turn to, we turn to each other and ourselves, right? We take that next step. We can't just stand around and be frustrated. We have to be the change we want to see. So if somebody else isn't going to do it, we need to do it. Whatever that is, we get together and decide what that is, and we need to do it.
And to follow up on that,
no Calvary.
There has to be a strong sense. I look now, I started in the civil rights movement in 1959. I'm 78 years old now, and I don't feel no way tired. You've got to have the passion and the excitement about what it is. And there were three things that we would do, Queen Shabazz. We organize, we strategize, and we mobilize. The organizing is going on with conversations like this. The strategies are being talked about, and the mobilization is going together. So when scientists and clergy and business come together, then we found that synergism that's going to hit. The other two words that kept us strong then, we were willing to sacrifice and risk. If you're not willing to sacrifice nor risk, you're not ready to get into the movement. This is a moral, ethical movement. So we are moving. So what you've got to do, remove your scales off your eyes and look around and grab somebody and get in it, because it is moving ahead now. And coronavirus is simply pushing us closer together. It is not dividing us. We're all in this together. So it is moving. We've organized, we've strategized, we've mobilized, we're willing to risk, and we're sacrificing. Otherwise, we'll all perish, as Dr. King said. We'll either live together as brothers and sisters or die together as fools. And none of us are fools right now in 2020. Well, there are a few.
So I'm going to jump in again, sir, if you don't mind. And I will say that please sign up for our updates if you don't. We believe the societal recovery for COVID is very similar to what we have been talking about for years that we need to do in order to deal with and also address the coming impacts of climate change, particularly in the Southeast, and that's to fix broken systems. And the only way to fix broken systems is for people to become involved in that system change and change it from the inside out. And we're going to be working to help build capacity to do that across the Southeast, connect the dots, and raise people up and empower people to do that, and work in partnerships with the Southeast Faith Leaders Network and Southeast Climate and Energy Network, Southern Alliance for Clean Energy, and the Southeast Energy Efficiency Alliance. So in partnership, all of us working together to lift all the boats in the Southeast, hopefully. And we've got a comment I'm going to throw in here, and then I'm just going to time check everybody. We have about 10 minutes left. So the comment is from Patrick Thompson. He says, many utilities are now offering no disconnect, reconnect fees, but that's more of a PR move. It costs the utility nothing to not expend resources. These are becoming like airline fees, where the people with the least pay more in fees, connect fees, service fees, and they're higher because you're not paying bills on a regular basis. Non-payment fees just piling onto the poor. What's really needed are payment plans that help people at the bottom of the pyramid with shorter work hours, loss of jobs, but more time at home using more electricity, gas for online, and more frequent laundry and body washing and things like that. So there wasn't a question there, but I thought it was a really valuable comment, and see what you all might think about that.
Sorry. And Dr. Hollis, I kept trying to say Florence, South Carolina, but I was on mute the whole time. So both of us will die today. But anyway, I think that part of what Dr. Durley and I have been talking about recently is starting a campaign to talk about energy democracy in the Southeast. One of our biggest environmental injustices that we have in the Southeast that's also incredibly economically unjust is our utilities, and the way that our utilities are ran, because the public has nothing at all to say or to do about it. Most of our public service commissioners, or you might call it public utility commissioner, whatever, however you might name it, are elected officials, but they have no interest in the public's interest at all. It's all about making profit. And so we get these unfair electricity rates, and we get these, and we have no say-so when it comes down to our public utilities or how we get energy because of this unfairness. And I think that it's high time that we stand up to our elected officials and let them know that we're now looking at their jobs. And we're saying, just as we elected you in, we can elect you out if you don't start putting the public back into public service.
Yeah, I'm gonna totally agree with you. I'm from Mobile, Alabama, and I grew up in the shadow of the paper mill down there, which is no longer there, thank goodness, and the Superfund sites. And my mom still lives there, and she has the same issues. My brother lives there, the two, in a different part of Mobile, and they have the same issues. And when you say, but I am gonna disagree with you. When you say we have no control over, you went on to say we need to look at them as, so we have control, and what we need to do is move these people out. I totally agree with you. I think that traditionally people have felt like they have had no control, but what we need to realize is that we've always had it, but because we never used it, people took advantage of that. And what we need to realize is that the power is ours, and the power is extra when we all work together. So I totally agree with you to look at this. We need to look at everybody who provides a service for us to survive, and look at whether or not they need to be the next target to be removed from office. I shouldn't say target, but the next, because you never know what people might do, but they need to be the next people who need to be voted out of office, right? And so, the power of our electorate is amazing when it comes to state and local actions, city and state actions. Federally, we're still working on that. But, I totally agree with you, and I have to say that. So.
Given the limited time that we have now, I'm going to ask each of you to think about a closing statement of 1 to 2 minutes about where we are, where you see us going, and how we can come together. But before I do that, I want to certainly thank Laura Seidel and Stephanie Blank, mothers and others, for bringing us together in this first real conversation. They'll be coming on next time to talk about these issues. But I think it's very important that we do this. And I want to thank you, Dr. Cobb, and all the work that you continue to do there, educating our young people. We're very much concerned about changing the curriculum in the historically Black colleges and universities, and going in down into the elementary schools and teaching them about all of this. Dr. Hollis, thank you so much for the insights and the wisdom that you've got, and your profoundness in looking at and connecting the dots. That's what we've got to do, more and more connecting the dots. My good friend, the Reverend Malcolm, I know you're a little shy about speaking about your feelings, but I want to thank you for speaking up today. And as most of you know, I chair the Interfaith Power and Light. 40 states, 22,000 houses of worship. And the things that you've talked about, we're going to be implementing those daily all over America, up into many of the reservations as well. So now I've given you enough time to think about a closing statement. And then we certainly want to ask Veronica Butcher to come on and close us out in her own inimitable way. And I'll start with you, Dr. Hollis.
I knew you were going to say that.
I tried to give you enough time.
You didn't. My statement is more of it's a realization that we need to reach. The Calvary is not coming. We are our saviors, right? And that's from a religious perspective and from an intelligent perspective. We need to work together, and we need to work together and realize the power we have, and that's political power. That's our voices at the most basic level. Whenever there's an opportunity to speak, do so. You don't have to have degrees, and you don't have to be a lawyer and a PhD, whatever, to speak your truth. And we need to start doing that. Everybody needs to do that.
Thank you. Dr. Cobb?
Yes, thank you so much. First, let me say this is the highlight of my lifetime to be on this esteemed panel with y'all and to feel the resonance from your passion and your work on a daily basis. Thank you for this opportunity. And, from a climate scientist perspective, the sense of urgency I feel is hard to communicate. How far we are from the solution sets that we need. We are at a time and we are behind the curve so profoundly that it literally keeps me up at night sometimes. But I think the way forward is to recognize all the things that Dr. Hollis was just saying, the ways in which we can pursue change at whatever scales with whatever levers we have in our hand, and that we have powerful, powerful levers at our fingertips. We just need to open our eyes and reach for them. Ideally, bring some friends along too, by the way. And I want to highlight a program at Georgia Tech called the Global Change Program that I direct, which is really squarely focused on thinking about how do we equip the next generation to the change agents that we need them to be, to recognize the interconnectedness of all these issues. They don't just become engineers. They have training and exposure to social injustice, racial injustice frames that they can bring to enact real change, not just build the next widgets, but think about the context that they land in and the solutions that we need. So I'm really proud to be part of that program and think about what it means to bring people together across the institution to think about what we can do to move Georgia Tech forward. And as it sits in the middle of this rich ecosystem of problems and solutions, how we can move the region forward through our work. Thank you.
Thank you so much. Reverend Malcolm?
I want to invite you all to our Creation Justice webinar on tomorrow at 12 p.m. I thought I was talking. I want to invite you all to Creation Justice webinar tomorrow at 12 p.m. We have Senator Cory Booker, who's going to be there, as well as some other guests. But I was sitting in a forum, and Reverend Dr. Gerald Durley said this. He said, "How can I preach to them in the pulpit, shout them in my pews, but they can't breathe out in public?"
Yeah.
This moved me because it told me that I must participate in the liberation of my people, the people that I serve, the people that I worship with, the people that I love, the people that I look out for, the people that look out for me. In order for us to be free, we've got to be free together. And if I have the knowledge to know and the skill set to do, then I must use that to help my people to be liberated. And I can look into the eyes of those who are on the panel who I can see, but I can imagine that the hearts of everybody else has other people's hearts connected to them. And if you don't get in this fight for yourself, you ought to be able to get in this fight for them. Because how can you, knowing what you know and having the skills that you have, sit back and allow other people to be impoverished and to be oppressed? Now is the time that we have the access to utilize the privilege and the access that we have to help others.
That is so powerful. We want to thank you, because words, I always like to close out any kind of meeting by saying we are on the winning team. Thoughts, we're on the winning team. So many times we wonder, How far have we come? Can we work together? Yes, we can, because our thoughts become our words become our behavior becomes our habits become our values, and our values become our destiny. And I believe that our destiny now is to all come together to make a difference, to mitigate against climate change, to get a healthy, clean atmosphere for not only our children, but for us as well. So thank you so much, panelists. And Veronica, thank you so much for allowing us to share today with this conversation. I know there are going to be many more conversations like this, but I want to say, get excited about what you're doing. Get excited about your work. The word enthusiasm is the word entheos, meaning in God. And if God is in your life, get excited. Don't come in and say, well, this is just another pandemic, or this is just another story. Get excited, because excitement is contagious. And we want all of you to get contagious, because we just heard from some powerful people who are excited and compassionate about what they're doing. Can you get excited just for a while? Thank you.
Thank you, Reverend Durley. I feel like everybody's probably clapping. Thank you to our panelists. Thank you for the audience. I'll just say, we are excited at Mothers and Others for Clean Air. We've got a lot of exciting content that we're going to be putting out virtually. We have the documentary coming out. So get engaged with us. We talk about this as this is a purple politics issue. We want to create a purple lane in the Southeast for these issues. This isn't political. These are people's lives. And our goal is that no more children die because of dirty air. No more people have to die. And, I think that there's a lot of hope-filled, positive change that's happening. We're here to help connect people, bring people out of silos. We had one last question come in about how do you do partnerships so that you're not disempowering vulnerable communities. For us, it's listening, which is why we did this format. And our event that got canceled was going to be a big listening session. So we're going to continue to do these monthly listening sessions. And we also are expanding our board to have designated seats. We've created the Healthy Air Alliance of the Southeast so that we can have listening tables and expert tables for each of these constituencies and connect people in their states. So we're open to ideas. We're open to hear what you're doing. We would love to partner. And I just want to say thank you all again so much, and have a wonderful day. And we look forward to the next conversation. Yes, stay safe. Wash your hands and wear your masks. Thanks, everybody.